You may already know that Uganda is a young nation. But did you know almost half of all people in Uganda are under the age of 15? By harnessing our potential, Uganda's future opportunities to grow and thrive are limitless. But to grow into healthy adults and reach our full potential, it is important that our diverse sexual and reproductive health needs are met. We especially need sexual and reproductive health services that we trust and feel are intended for us. Adolescent and youth-friendly sexual and reproductive health services are responsive to our specific needs, vulnerabilities, and desires and respect our diverse sexual and reproductive realities, thereby attracting young people and increasing the likelihood that young people will use the services available to them. While youth-friendly sexual and reproductive health care includes family planning, it can be difficult for adolescents and youth to find contraceptive services that are responsive to our needs and preferences.
The mere fact that you're a young person, sometimes below 18, you're merely denied the service despite the fact that you need it.
So the person has the liberty to say, I feel like that is age appropriate for you, not age appropriate for you.
In some parts of the country where access remains low, young people may not be able to pay for contraceptive services.
But again, there are a lot of other, kind of barriers when you speak about young people with disabilities. The barrier there is really the reasonable accommodation for them.
Without access to family planning services, our futures and the future of our nation are threatened. Almost half of all pregnancies among young people under age 20 are unintended. This is not surprising because of married women ages 15 to 19 who do not want a child for at least 2 years, 61% are not using modern contraceptive methods. Teenage pregnancy can put our futures at risk, leading us to drop out of school and limiting our economic opportunities. If young people are not facing some of the challenges like teenage pregnancy, and they are able to access education and they are able to access job opportunities, then they can contribute financially towards the country. We can help reduce teenage pregnancies by providing young people with the contraceptives they need. Contraceptives prevent unintended pregnancies, decreasing the number of unsafe abortions and lowering death and disability related to complications from pregnancy and childbirth. For every 3,500 Ugandan shillings spent on contraceptive services for adolescents, over 9,000 shillings are saved on maternal and newborn health care. These savings could be used to fund additional contraceptive services for young people. While the government of Uganda has made efforts to improve family planning access, there is still work to be done. Uganda has fallen short of its family planning financing commitment of $5 million, allocating only $4 million to the reproductive health budget line in fiscal year 2019 to 2020. However, more than 95% of the $4 million of domestic funding for reproductive health was used to procure mama kits, leaving very little for contraceptive commodities. Without a specific, protected budget line for family planning commodities and services, health facilities cannot provide the adolescents and youth with the family planning services we need. How do we ensure that young people's family planning needs are met? The Ministry of Health should create an independent budget line for adolescent and youth family planning services under the National Health Budget. But we can't stop there. When policymakers involve us in making decisions about our own health, programs are more effective and resources are used more efficiently to meet our needs.
If young people are invited at these tables where these policies and these decisions are being made, they're able to communicate what exactly is affecting them, and then the policies that are going to be designed are going to be in line with their specific needs.
The young people are not a homogeneous group of people, they are heterogeneous. So you might find that there's one representative or two representatives that are given audience to go and participate. However, they do not speak for all the groups of young people.
We need an intersectional approach to that as well, including youth from different categories, including youth with disabilities, including young adolescent girls.
At certain levels, young people are involved. In reality, they're not being consulted. It is just saying, we had a young person on the panel. A young person showed up for the talk show and issues like that. Yet in reality, this young person did not take part in the real process.
Members of Parliament should meaningfully involve existing youth organizations and work with youth and adolescents as partners to ensure that funding decisions for family planning are inclusive and meet the diverse needs of youth. To secure the future of the nation we love, we must work together to make sure that young people can access the family planning services we need and that our ideas and contributions are shared and valued.